generations have gone through, other periods of crisis in this country. 53 days is nothing. We've dealt with really intense, terrible situations for a long time in the past, but it feels very long, and it's very stressful. And that's across the board. You know, you have families that haven't had a paycheck come in a couple of months, and meanwhile the bills keep coming in. That's tremendous economic anxiety and insecurity. And by the way, it's exactly right. When do I go back to work? When do I get another paycheck? And that's a pressure that people feel in the household. Even the good part of it, well, my family's together. I have all my 3 girls, in my case, with me, and that's nice, and that's good news. But you put even the family together, and you lock them up, cabin fever, and everybody has their own stress that they're dealing with, and everyone's trying to figure out their life, and they're all together in this intense period. Even that is stressful. I feel it in my own household. My daughters are getting tired of my jokes, believe it or not. How that can happen, I have no idea, but somehow they manage to do that. We even have trouble now picking a movie at night, because the rule is if you pick a bad movie, then you are on movie probation. You don't get to pick the next movie. Everybody is on movie probation in my house now, so that's a problem. Even the dog, Captain, is out of sorts and relating to stress. Maybe there's too many people in the house and he's having trouble adjusting. Captain doesn't like the boyfriend. I said I like the boyfriend, so it's nothing that I said, but all sorts of tension that people are living with. Real tension, and then just the day-to-day stress. So, yes, it's a terrible period of time. I get it. But we have to deal with it. And when you look at the reality of the situation, we are actually in a much better place. We're not home yet, but we're in a better place. The really bad news would have been if we concluded that we couldn't control the spread of the virus. That was a possibility. You looked at all those initial projections. How do you know that we could control the spread? We could have done all those close-down measures, and it didn't work. And the spread continued. That would have been bad news. So relatively, we're in a relatively good place. In downstate New York, the curve is on the descent. The question is now, how long is that descent? Is it a sudden drop-off? Is it 1 week, 2 weeks, 3 weeks, 6 weeks? We don't know. But better to be going down than to be going up, right? Let's keep that in mind. And we are going down. How fast? We'll find out. But we're in a better place. Hospitalization numbers are coming down. Intubations are coming down. Number of new people going into the hospital every day is still troublingly high, but better than it was, but still problematic. Number of lives lost is still breathtakingly painful, and the worst news that I have to deliver every day, and the worst news that I've ever had to deal with as governor of New York. But at least it's not going up anymore, and it seems to be on a gentle decline. But make no mistake, this is a profound moment in history. Our actions are going to shape our future, and you're not going to have to wait for a 10-year analysis, a retrospective, to find out how our actions affected our future. What we do today, you will see the results in 3, 4, or 5 days, okay? You tell me what the people of this state and this country do today, you will see the results in the number of hospitalizations in just a few days. We get reckless today. There are a lot of contacts today, unprotected contacts today. You'll see that hospitalization rate go up 3, 4, 5 days from today. It is that simple. And it's that pressing that every decision we make is going to affect how we come out of this, how fast we come out of this. So in this moment, more than any other, truth, not what you would like to see, what you hope to see, not emotions, truth and facts. Truth and facts. That's how we operate here in the state of New York. Truth and facts. Give me the truth and give me the facts. And that has to guide our actions, period. We had a productive meeting at the White House yesterday, productive visit. Sort of everybody says productive visit. Very few people come out and say unproductive visit, right? What does that mean, productive visit? To me, a productive visit means we spoke truth, we spoke facts, we made decisions, and we have a plan going forward. And that was accomplished yesterday. And I feel good about it personally, because it's what should have happened, right? The big issues on the table in the political process, well, he said this, she said this, and you get into a he said, she said, or you get into a blame game, finger pointing. But the meeting was very productive. And by the way, these are people in the White House who politically don't like me. You know, that's the fact, right? You see the president's tweets. He's often tweeted very unkind things about me and my brother. Politically, he does not. We've had conflicts back and forth. But we sat with him, we sat with his team, and that was put aside. Because who really cares how I feel or how he feels? Who cares? Get the job done. I don't care if you like him or he likes you. It's we're not setting up a possible marriage here. Just do the job, right? When you're at war, you're in a foxhole. Nobody says, well, do you like the person you're in the foxhole with? Who cares? You protect the other person in the foxhole, then you get out of the foxhole and you take the hill, charge up the hill. And that's how we should be operating now. I don't care what your politics are. I don't care what you think about my politics. It doesn't matter. We both have a job to do. Let's do the job. And that was the spirit of the meeting yesterday. And it was very productive on what were very contentious, unclear issues. So it was very good. The main issue was testing, which I'll talk more about in a second. But we also talked about state funding. All the governors are united, Democrat and Republican, National Governors Association. Every governor is saying the same thing. We have to have state funding. The states are all basically in a deficit situation, and we need funding from Washington. They've passed bills that help a lot of Americans. That's great. Help small businesses. That's great. But you have to help state governments, because state governments fund people that the federal government can't fund. You know, state and local governments, we're funding police, we're funding fire, we're funding teachers, we're funding schools. You can't just ignore them. And when you don't fund the states, then you're saying to the states, well, you have to fund them. And the states have already said in one united choir, we can't. We can't. So we talked to the president about that. The president gets it. The president says he's going to work very hard in the next piece of legislation. But you know, I've been in Washington. I was there for 8 years. The Congress has to insist that this is in the legislation. And yes, they passed funding for small business and funding for testing, and that's good. That is a good thing. It's not a bad thing. But it's not enough either. And they don't come back every day, the Congress. It's hard to get them to come back. And this was not the time for baby steps. This is when you should be taking bold action, right? The action is proportionate to the issue. And you haven't had a problem that is any bigger than this that any of those senators or Congress people have ever dealt with. Well, then your action should be proportionate and responsive to the problem. And it wasn't. The president also agreed, which is a big deal for New York, to waive what's called the state match for FEMA. Normally, a state has to pay 25% of the FEMA cost. That would be a cruel irony for New York and adding insult to injury. New York had the highest number of coronavirus cases in the country. Therefore, our cost of FEMA was the highest cost in the nation. And therefore, New York should pay the highest amount. How ironically cruel would that be? You're going to penalize us for having the highest number of coronavirus cases in the country. And at the same time that Congress passed a piece of legislation not even funding the states. So the president agreed to waive that, and that is a very big deal. That's hundreds of millions of dollars to the state of New York. But the big issue was testing. And we've been talking about testing, tracing, and then isolating. And that is going to be the key going forward. That's how you are educated and have some data points as you're working your way through this reopening calibration, right? How does it work? You test the person. If the person winds up positive, you then trace that person's contacts, contact tracing. You have to start with a large number of tests. And we set as a goal yesterday to double the number of state tests, to go from 20,000 on average to 40,000. That is just about the maximum capacity for all of the laboratory machines in the state. Okay, we have private labs, about 300 of them, that we regulate. They have purchased machines over time. These are very expensive machines. If you took every machine we had and they had all the supplies they needed from the national manufacturers, and you ran that machine 7 days a week, 24 hours a day, how many tests could you do? About 40,000. So that's, if you put your foot to the floor, you brought the engine up to maximum RPM, up to the red line, you brought it up to 6,000, assuming the red line was 6,000, and you held it there 7 days, 24 hours a day, at red line, how many tests could you do? 40,000. Now, there's a lot of buts and ifs in there. But the machine has to stay together for 7 days, 24 hours a day. You have to have enough people feeding the machine, but that is our maximum potential. So where did we set the goal? At our maximum potential. Why? Because we need to. Well, it's unrealistic. It might be a little unrealistic, but I'd rather set the bar high and try to get there, and then whatever we get is what we get. But once you do all those tests, every positive you have to go back and trace. And the tracing is a very big, big deal. Once you trace and you find more positives, then you isolate the positives. They're under quarantine, they can't go out, they can't infect anybody else. This entire operation has never been done before. So it's intimidating. You've never heard the words testing, tracing, isolate before. No one has. We've just never done this. There were a few textbooks that spoke about it, but we've never done it. And we've never done it anywhere near this scale. So it is an intimidating exercise. But I say, so what? Who cares that you've never done it? That's really irrelevant. It's what we have to do now. So figure out how to do it. Well, we have to put together a tracing army. Yes. Okay, we put together armies before. Never a tracing army. But we can put together people, we can organize, we can train, and we can do it. And yes, it's a big deal, but it's what we have to do, and it's what we will do. We want to operate on a tri-state basis. I've spoken to Governor Murphy in New Jersey, who's doing a great job, and Governor Lamont in Connecticut is doing a great job, and who have been very great neighbors to New York. It's best to do this tracing on a tri-state area. Why? Because that's how our society works. The virus doesn't stop at jurisdictional boundaries. Whoop, I'm at the town of Brookhaven, I stop here. No, the virus doesn't say that. The virus just spreads. And you look at the spread pattern of the virus, it is in a metropolitan area. So we'll work together. This is going to be a massive undertaking. Good news is Mayor Michael Bloomberg has volunteered to help us develop and implement the tracing program. Mayor Bloomberg was mayor of New York City, as you know, 3 terms. As governor, I worked with Mayor Bloomberg. He has then developed an organization. He works with mayors all across the world, literally, in providing them guidance. He has tremendous insight, both governmentally and from a private sector business perspective in this. Remember, his company, Bloomberg, they went through the China close down, open up. They went through the European close down, open up. So he's had quite a bit of experience in this area. It's a very big undertaking, and we thank him very much for taking it on, because it is going to require a lot of attention, a lot of insight, a lot of experience, and a lot of resources. We're also going to be partnering with Johns Hopkins and Vital Strategies in putting together that tracing operation. It'll be coordinated tri-state and downstate. Why downstate? Because, again, downstate operates as one area. About 25%, 30% of the workforce that goes into New York City comes from outside of New York City. I have a house in Westchester. I work in New York City. Who's supposed to trace me? Westchester or New York City? If I turn up positive, yeah, my residence is in Westchester County. But I work in New York City, and I would have contacted many more people in New York City than I did in Westchester. Because that's where, if I work in New York City, that's where I'm contacting people. I live in Suffolk, but I work in New York City. I'm a police officer who has a house in Rockland, but I work in New York City. I'm a firefighter who lives in Rockland or Orange, but I work in New York City. I live in New Jersey, but I work in the city. I live in the city, but I work in Connecticut, right? So all those interconnections, if you're going to do these tracing operations, you can't do it within just your own county, because you'll quickly run into people who are cross-jurisdictional. So understand that going in. Blur the governmental jurisdictions because they don't really make sense. Put everybody together, work together. Harder done than said, but 100% right. There's no doubt about that. We're going to take the initial tracers that people have now. The state has about 225 today. Rockland is 40, Westchester is 50, Nassau 60, New York City 200. They're going to work together. Mayor Bloomberg is going to start with that core, but we have to build on that because we will literally need thousands. SUNY and CUNY have 35,000 medical students that we're going to draw from, but we have to put together a significant operation because the numbers get very big very quickly here. Today is also the 50th anniversary of Earth Day. When you look at many of the numbers that we're finding, and you look at the disparity between the African American community, Latino community that has a higher rate of infection than people in the white community, you start to ask why, and you start to study those health disparities. You also find that in those areas where the coronavirus infection rate is higher, they tend to be minority areas. And by the way, those minority areas tend to be the places where we cited plants that pollute. The asthma rates, respiratory illnesses are 3 times higher among people in the African American community. 3 times the asthma rate, the respiratory illness rate. They're getting more coronavirus. They're a higher percentage of essential workers. You see how these 2 factors come together and make a bad situation worse. Let's learn from that. It's one of the lessons that we have to learn, and we have to go forward. and we will. The positive message is, look how well we do when we actually focus and we make a decision and we say we have to do this. If you had told me 2 months ago that I would be able to stand up before the people of the state and say, by the way, we have to close down everything, businesses close, everything closes, everybody go into the home, close the door, lock it, don't come out, I would have said, it's not going to work. It's not going to work. You're not going to get 19 million New Yorkers who are just a defiant group of people, question everything. They're not going to do it. Well, maybe if you give them all the facts and they understand, then they'll do it. And we did. Look at the potential. Look at the possibility of what you can actually do. Well, then can you really make a real difference on these issues that we've been fighting for decades, but we haven't really made the progress we need to? Climate change, the environment. Yes, you can. Last point. My phone is ringing. I'm talking to many local officials. They feel political pressure to open. I understand. I said yesterday that we're going to make decisions based on a regional basis because just as the nation has different states in different positions, New York State has different regions in different positions. North Country has one set of facts. This is about truth and facts. North Country has one set of facts. Western New York has a different set of facts. Capital District has a different set of facts. Make decisions based on the facts, and the facts are different than downstate New York in many areas. Also, make them on the facts and realize the consequence of what you could do opening one region but not other regions, and how you could flood that one region and give them a host of problems they never anticipated. But make the decision on the facts. I get it. Don't make the decision based on political pressure. I'm not going to do that. I am not going to do that. This is a profound moment. We make a bad move, it's going to set us back. And I get the political pressure, and I get the political pressure that local officials are under. We can't make a bad decision. I get the pressure, but we can't make a bad decision. Frankly, this is no time to act stupidly, period. I don't know how else to say it. And I've said it innumerable times to local officials on the phone. I get the pressure, I get the politics. We can't make a bad decision, and we can't be stupid about it. This is not going to be over anytime soon. I know people want out. I get it. I know people want to get back to work. I know people need a paycheck. I know this is unsustainable. I also know more people will die if we are not smart. I know that. I have to do that count every day of the number of people who passed away. We're not going to have people lose their life because we acted imprudently. I'm not going to do that. I'm not going to do that. And I'm not going to allow the state to do it. And I'm not going to have the obituary of this period be, well, they felt political pressure, so they got nervous and they acted imprudently. That's not who we are. I've said to them, look, if you look at any of the facts, the 1918 flu, they're talking about it now. There can be waves to this, right? You walk out into the ocean, you get hit with that first wave. Oh, great, I'm done. The wave hit me, I'm still standing. Beware, because there can be a second wave, or there could be a third wave. So don't be cocky just because you got hit by a wave and it didn't knock you off your feet. There can be a second wave. And if you're not ready for the second wave, that's the wave that's going to knock you down because you're not ready for it. So that's what I'm worried about. And also to the local officials and the local politicians. I have no problem with them blaming me. It's a very simple answer. Say to everyone, whatever they say, I agree with you. It's the governor. Because, by the way, it is the governor. It is. These are state laws that are in effect. The local official can't do anything about them anyway because they can't contradict the state law. So it's true. So the local official can say, it's the governor, blame him. It's true. And it will stop us from doing something that's counterproductive. And it'll also stop us from getting into a dispute between me and the local government where the net message will be to the people, there's disagreement or confusion among government. And this is not the time for confusion or disagreement among government. So the state laws govern. I get the local political pressure. Blame the governor. It's the truth. And the state laws can't the local laws can't counteract state laws anyway. And to this political pressure, this is a quote that I think people should take to heart. When the freedom they wished for most was freedom from responsibility, then they ceased to be free. Edith Hamilton, originally Edward Gibbon in The History of the Decline and Fall of the Roman Empire. When the freedom they wished for most was freedom from responsibility, then they ceased to be free. We have a responsibility today to ourselves and to others. There is a codependency and a mutuality among people in society that is more clear and distinct than we have ever seen it. You sneeze, I get sick. You sneeze, I get sick. It is that close a connection. You have a responsibility to act prudently vis-a-vis other people. Because you're not just putting your own life at risk. You're risking my life and my children's life and my parents' life, and you don't have that right. You have to act responsibly. And to advocate for total irresponsibility, let's all be irresponsible. No, not here, not now. Any questions?
Governor, what is Michael Bloomberg going to be doing? Can you talk about how that's going to dovetail with what the city announced today?
Let's try another new first and the new normal. We don't need to speak over each other. I will answer your question, so let each person ask a question, and then we'll go on to the next.
Governor, talk to me specifically. Is Michael Bloomberg provided funding? Are you giving him the power to hire people? And Mayor de Blasio this morning talked about the city launching its own effort to do tracing and testing. How will the two things overlap?
They will all be coordinated. City's effort will be coordinated. Nassau's effort, Suffolk's effort, Westchester's effort. They will be hiring people independently. You have city employees that chart with the number of employees. Those will be Westchester employees, state employees, city employees. But it all has to be coordinated. There is no tracing that can work within one jurisdiction.
So Michael Bloomberg is leading some
let me just finish.
Coordinating council?
Yeah, let me just finish. You cannot trace someone within the boundaries of New York City, because once the person goes outside of New York City, well, now that would be a Westchester person, right? I live in Westchester, take me. I lived in Westchester. I worked in New York City. New York City is going to trace me? How? I'm in Westchester. That's a different county. You can't trace me. Well, we'll go trace people in Westchester. Oh, no. Then Westchester is going to say, that's my resident. Don't come in here and trace my resident. All right, let's forget the jurisdictional fight and the political local fight. We'll coordinate everyone. This is a monumental undertaking. Who's going to do it? We're all going to do it. City, state, Nassau, Suffolk, Jersey, Connecticut. Okay, how do we do it? I don't know. We've never done it before. Michael Bloomberg will design the program, design the training. He's going to make a financial contribution also, put together an organization that can help hire the people, because we have to expand this number tenfold, and get this all done like this. This has to happen. You don't have months to plan and do this. You have weeks to get this up and running. Super ambitious undertaking. and Mayor Bloomberg will help coordinate the entire effort. He'll be working with the state. I'm working with the city and the Nassau and Suffolk and Jersey and Connecticut.
How much money giving?
It's really nice. Well, this is great to be here, and we're doing something I love doing, planting trees. I've always loved it. And we get great trees. The First Lady and I are very grateful to be here on the South Lawn of the White House as we celebrate the 50th Annual Earth Day, National Park Week, and the upcoming Arbor Day. And that's going to be, tell me, David. That's right, Friday. Thank you. As more than 180 nations around the world battle the vicious coronavirus, we continue to mourn the precious souls who have been lost, so sadly lost, and so unnecessarily lost. It should have been stopped, and it should have been stopped right where it started, and everyone knows where it started. But in this time of trial, the beauty of springtime fills us with the peace and the hope of renewal. We're pleased to be joined by our great Vice President, Mike Pence. Please, Mike, stand up. You have done such a great job on getting us open again. We're opening again, Mike. It's starting to move. A lot of states are in great shape, and they're starting to move it along. And very importantly, Karen Pence, who's been so fantastic and did such a great job representing the country. Thank you, Karen. Beautiful job. Also here are Secretaries David Bernhardt, Sonny Perdue, Administrator Wheeler, Andrew Wheeler, thank you, and Leader Kevin McCarthy. And what a job he's done. And good vote the other day, yesterday, that was good. How's it, no, but previous to that. And when are you voting on the Thursday? Good. Is that a guarantee, or there's no guarantee? There's never a guarantee when you're dealing with people, right? But anyway, but it's in good shape, right? Yeah. Thank you, Kevin, very much. On this special occasion, we are renewing our strong national commitment on conserving the wonders of God's creation. One of the most important ways we uphold this tradition is by protecting our priceless national parks and our public lands. To support our all-out war against the virus, many of the places that we have here with temporary closing, but we will have them open quickly. As we said, we're starting to open our country again. Thanks to our significant progress against the invisible enemy, I'm pleased to announce that in line with my administration's guidelines for opening up America again, we will begin to reopen our national parks and public lands for the American people to enjoy. So what is that? Now tell us about that, David.
Roll out with the governor.
Right, roll out. Good.
We'll begin to reopen facilities. And,
When will they start?
we'll run right along the side of the governor.
That's great. Okay. That's going to be very exciting. That's going to be very exciting. You have a lot of land to open up, too, don't you? Huh? People are going to be very happy. On this Earth Day, we celebrate that America leads the world in environmental stewardship, which is so true. I see it. I see the love and devotion that so many people like David, like you give, and that we continue to have among the cleanest air and the cleanest water anywhere on the planet Earth. We're also honoring our country's heritage of conservation, including through the support of 1 trillion trees. And that's the 1 Trillion Tree Initiative, which is a very big deal. We'll be planting over a period of time 1 trillion trees. That's a lot of trees, Kevin. How do we do that? Huh? Do you have any ideas? Huh?
We even have a bill.
That's great. That's great. That's going to be exciting. As a sign of our dedication, in a few moments, the First Lady and I will plant a maple tree right here on the South Lawn of the White House. And wherever the tree is, where is this tree now? That's a beautiful straight trunk. That's a AAA tree. That's great. As our nation grows stronger and greater in the months and years to come, and we will be bigger, better, stronger than ever before. You watch what's happening. You see it happening already. There's such spirit with the concept of the state starting to open, such incredible spirit. This tree will grow also, and it'll stand tall and beautiful, and the future generations will be looking at it, and they'll say, I wonder who planted that tree. And we'll say it was Kevin and David and Mike and Karen and a whole group of people. and we really appreciate it. But they'll be admiring this tree, and they'll be admiring 9 more trees. We're planting 10 beautiful specimen trees. They're specimens, all specimens. People may think that's an exaggeration or that's a Trump term. Actually, they're sold as specimens. They cost more money, but they are better. I buy a lot of them. And now I'd like to invite the Vice President up and Karen to say a few words, please. Thank you.
Well, thank you, Mr. President, and it is a great honor for us to be here on the South Lawn with you and the First Lady to be able to plant a tree of promise and a tree of hope. I know we are here in the midst of National Park Week, just a few days before Arbor Day on the 50th anniversary of Earth Day, to plant and commemorate this beautiful maple tree. But as you said, Mr. President, we also gather at a time of great challenge in the life of our nation, but it's a time the American people have met the challenge. And as you've observed, Mr. President, that with your leadership, the American people are beginning to step forward. The states around the country are beginning to put into practice the guidelines to open up America again. And you're a president who knows that America works when America is working. And on behalf of the entire White House Coronavirus Task Force, I can assure the American people that we're going to work very closely with your governors every day to get America safely and responsibly back to work. But today, with the planting of this tree, Mr. President, you also renew your commitment to preserve and protect and allow for the enjoyment of the vast natural resources of this nation. I've often thought that the 3 pillars of American greatness are our faith, our freedom, and our vast natural resources. And today we celebrate that with the planting of this new tree. We also celebrate it with the word from the Secretary that at your direction in the days ahead, we'll work closely with governors to reopen our national parks so that the American people can enjoy the blessings of those extraordinary places that our family has traveled to so many different times. Mr. President, I can tell you that Karen and I have so many fond memories of loading up in the minivan, driving across the country, making our way to Yellowstone and the Grand Canyon and to Yosemite, and I know the American people are anxious to see us on this Earth Day 2020, a few days from Arbor Day. They're anxious to get back to enjoying all of those beautiful parks, and will greatly welcome your direction. And so we thank you for your leadership during this challenging time, Mr. President. We want to thank the First Lady for her extraordinary compassion, the way she supported American families throughout this ordeal. And I'm absolutely convinced that with your continued leadership, with the strong leadership that we have at states across the country, with the cooperation of the American people, that our nation will be growing again soon, just like this beautiful maple will for many years to come. So thank you, Mr. President.
Thank you very much.
God bless you.
Thank you very much. Kevin, would you come up and say a few words? And why don't you stay right there, Mike? Perfect.
Mr. President, First Lady, Vice President, Karen, our Second Lady, I want to thank you for your work. I want to thank you for your commitment for the health and safety of every human. Today, we're witnessing the planting of the tree of the hope and dream that we know tomorrow will be better than today. That the earth will be stronger with our health tomorrow than it was today. This is the first of 1 trillion trees that will be planted around the world. Trees are the lungs of the earth. They inhale carbon dioxide and they exhale oxygen. When 1 trillion trees are planted around this earth, that will remove the equivalent of 2/3 of all man-made carbon dioxide, or all carbon, since the Industrial Revolution until today. So as you continue to work for the health of every human, you show today you're working to make sure the health is even greater with this earth. So I congratulate you on this. And the first of 1 trillion just proves that America will lead the way in every industry, in every part, making it environmentally sound and common sense, but also lead the world in an opportunity that tomorrow will be better. Thank you.
Thank you, Kevin. Beautiful. Thank you. He gave a lot of facts that a lot of people didn't know, including me. I thought that I just spoke with our great First Lady, and she said, you know, it'd be wonderful for Karen Pence to say a few words. People have no idea the incredible job Karen Pence does representing this nation. Everybody loves her. She's special in every way. And Karen, I'd like to have you say a few words, please. She didn't know this, but I'd like to.
Thank you, Mr. President. I do cherish the opportunity to speak because David and I were just talking about while this tree makes the earth better and stronger, we talked a lot about mental health, and that's an issue that I know the First Lady has been dealing with her whole time that she's been First Lady. But I've just started doing a little bit with Prevents, and we do want people to understand that during this crisis, we need to also mitigate the effects that on our mental health. And so we ask people to watch out for yourself, check in with yourself every day, check in with those you love. If there's something that you like to do, for me it's painting, maybe it's gardening, maybe it's reading or cooking. We ask people to schedule that into your day so that you have a little bit of time that's just for you each day. And then we also ask that you talk about the struggles, but also talk about the successes. So as you have kids who are struggling with not having their graduation ceremony, or they're not being able to go out and play sports, or they're missing their friends or their teachers, it's important to talk with them and let them get those issues out, but also talk about the successes, some of the great things that are happening while we're having to stay at home, things you're learning about your family, games you're starting to play that maybe you didn't play before. And then last of all, if you're worried about somebody or you're worried about yourself, please reach out. If you go to facebook.com/weareprevents, there's so much help out there. We don't want anybody to feel like there isn't help because it's okay to say, I'm not okay. Thank you.
Thank you, Karen. That's beautiful. So, Mike, let's go over and do it.
Okay.
Okay, we ready? Take that one. Come on, Mike, stay right here. Come on, get up here. Karen, you grab that shovel. Come on. You grab it together, right? You ready? Let's go. We'll do another one. Come on. Here, we'll do one by ourselves and then you can let them do one. Okay. You don't have to. Ready? Honey, grab one. You grab one. We'll do it. Okay. Come on. Very good. That's great.
Happy birthday, by the way.
That's good. That's good.
Thank you, Mr. President.
Sonny, David, Kevin, come on up here. We have plenty of dirt left. Come on. Come on, fellas. This is some team.
This is something we can do really well.
Yeah. You know what I'm doing.
Right, Sonny?
You ready?
We know how to shovel stuff.
1, 2, 3. Better. You know, you'll ruin your reputation.
There you go.
Your reputation with the farmers would be shot.
Well, yeah, no,
All right.
I know they said it was so, Mr. President.
Come on. Ready? Yes. Very good. Okay. Thank you all. Thank you all. Let's go.
All right.
Thank you very much, everybody. Thank you. Thank you very much.
Nice and warm out here today.
That's about it. Everything good? I think so.
Don't and even within regions.
Most
of the epidemics in Western Europe appear to be stable or declining. Although numbers are low, we see worrying upward trends in Africa, Central and South America, and Eastern Europe. Most countries are still in the early stages of their epidemics, and some that were affected early in the pandemic are now starting to see a resurgence in cases. Make no mistake, we have a long way to go. This virus will be with us for a long time. There is no question that stay-at-home orders and other physical distancing measures have successfully suppressed transmission in many countries. But this virus remains extremely dangerous. Early evidence suggests most of the world's population remains susceptible. That means epidemics can easily reignite. One of the greatest dangers we face now is complacency. People in countries with stay-at-home orders are understandably frustrated with being confined to their homes for weeks on end. People understandably want to get on with their lives because their lives and livelihoods are at stake. That's what WHO wants to, and that's what we're working for all day, every day. But the world will not and cannot go back to the way things were. There must be a new normal, a world that's healthier, safer, and better prepared. The same public health measures we have been advocating since the beginning of the pandemic must remain the backbone of the response in all countries. Find every case, isolate every case, test every case, care for every case, trace and quarantine every contact, and educate, engage, and empower your people. This cannot be effective. The fight cannot be effective without empowering our people and without full participation of our people. Countries that do not do these 6 central things and do them consistently will see more cases and more lives will be lost. To be clear, WHO's advice is to find and test every suspected case, not every person in a population. WHO is committed to supporting all countries to save lives. And we're also committed to human rights and to fighting stigma and discrimination wherever we see it. There are disturbing reports in many countries in all regions about discrimination related to COVID-19. Stigma and discrimination are never acceptable anywhere at any time and must be fought in all countries. As I have said in many times, this is a time for solidarity, not stigma. WHO is also working actively to address the impacts of the pandemic on mental health. Working with mental health experts around the world, WHO has produced technical guidance for individuals and health workers, recognizing the enormous strain they're under. In addition, we have also developed a free children's book about COVID-19 with partners from UNICEF, UNHCR, IFRC, and UNESCO, among others. In less than 2 weeks, we received requests to translate the book into more than 100 languages. And the book is now being used among Rohingya children in Cox's Bazar and children in Syria, Yemen, Iraq, Greece, and Nigeria. One of WHO's core functions is to provide evidence-based technical advice to countries. This is not something we do alone. Every day, we work with thousands of experts all over the world to collect, analyze, and synthesize the best science and turn it into guidance that we give back to countries. Through thousands of hours of discussion, we have exchanged first-hand experience and debated the science to generate the advice that we make available to all countries. We then work with countries to turn that guidance into action. WHO has staff in 150 countries all over the world, working directly with government, scientists, and partners to coordinate national preparedness and response plans and to implement them. I would like to use this opportunity to thank all my colleagues all over the world in all our 150 offices for their hard work and commitment. In addition, WHO has sent more than 70 surge teams to countries to strengthen surveillance and provide advice on infection prevention, how to treat patients, risk communication, lab capacity, data management, and much, much more. We have also brought in external support through our global outbreak alert and response network and specialist emergency medical teams, what we call GORN, or Emergency Medical Teams, EMTs. And I would like to thank GORN. In addition to supporting countries, we also track progress globally among countries that have reported data to WHO. 78% have a preparedness and response plan in place. 76% have surveillance systems in place to detect cases. And 91% have lab testing capacity for COVID-19. But we still see many gaps around the world. Only 66% of countries have a clinical referral system in place to care for COVID-19 patients. Only 48% have a community engagement plan. And only 48% have an infection prevention and control program and standards for water, sanitation, and hygiene in health facilities. In other words, there are still many gaps in the world's defenses, and no single country has everything in place. WHO will continue working with countries and the international community to close these gaps and build sustainable capacities for now and the future. But we're not alone. We work with partners all over the world to harness their expertise and networks. Earlier this week, WHO and the International Telecommunication Union announced that we're partnering with telecommunications companies to reach people directly on their mobile phones with text messages about COVID-19. This will help reach half of the world's population that doesn't have internet access, starting in the Asia-Pacific region and then rolling out globally. We're calling on all telecommunications companies globally to join this initiative to help unleash the power of communication technology to save lives. We also issued a call with the World Trade Organization, calling on countries to ensure the normal cross-border flow of vital medical supplies and other goods and services, and to resolve unnecessary disruptions to global supply chains. We need to ensure these products reach those in need quickly, and we emphasize the importance of regulatory cooperation and international standards. Finally, with the holy month of Ramadan starting tomorrow, I would like to wish all Muslims around the world Ramadan Kareem. This is a season of reflection and community, an opportunity for kindness and solidarity. Earlier today, I spoke to health ministers from across the Eastern Mediterranean region. I assured them that we will stand in solidarity with them, as we will stand with all countries. We're all in this together, and we will only get through it together. Again, Ramadan Kareem. Shukran jazilan.
Thank you very much, Dr. Tedros, for these opening remarks. So we will start with questions. So I will remind journalists that they can, if they are joining us online, that they can select the language on the interpretation tab, and that obviously you can ask questions in any of 6 UN languages and many more to come. So maybe we will start now with Dakar, with Senegal. Réveil Dakar, and that's Tierno. Can you hear us, please? Sorry, I think there was a little issue. Let's go to maybe, do we have Jeremy on from? Let's go to Jeremy from RFI. Jeremy, can you hear us?
Yes, can you hear me, Tarek?
Yes, please go ahead.
Thanks for taking my questions. Good evening to everyone. A question about your position on easing or maintaining the lockdown for people at risk and people over 60 years old, considering what Dr. Tedros said, that we won't see basically the end of this until we have a safe vaccine. It means next year, probably. So does it mean that we have to refrain ourselves from seeing our parents or grandparents until then? Is it what WHO mean in the end? Thank you.
So thank you for the question. I will start. So there are a lot of considerations that need to be taken into account when countries and decision makers are deciding to lift some of these public health and social measures. It's not a one-size-fits-all. And what countries need to do and what decision makers need to do is to evaluate the situation in their countries at the lowest administrative level as they can to determine what can be lifted, where, and when. And so we have outlined a number of factors that need to be taken into consideration. First and foremost is to really understand where this virus is, how far it's being transmitted, and if it is controlled. And there are measures in which you can look to see if that's actually being achieved, how many of the cases are actually being detected. It's very important that once an understanding of this virus is understood through the surveillance activities, countries need sufficient systems in place to be able to detect any new cases that come up. And so that's really important, so that if there is a resurgence, and we are seeing in a number of countries now that those that were successful in controlling, they are seeing a resurgence in cases again. And that's because a large proportion of the population does remain susceptible. And so there are a number of additional factors that we've outlined that need to be taken into consideration, but it doesn't mean that you won't see your families for long periods of time. There may be situations in which these measures can be lifted, but it will have to be done in a controlled way. It doesn't mean that you can't see your family members through social media and through other kinds of communication, but I realize that's absolutely not the same as being able to give them a hug. And so there isn't a one-size-fits-all. What we've tried to do is we've tried to outline the considerations that need to be taken into place for those who can make those decisions, and then given the context, the decisions will have to be made at that lower administrative level.
And if I could add, I think your question referred specifically to older persons living in society, and each society is structured in different ways. In many societies, older people live in generational families and are continuing to do so, and families are doing their best to protect them. What we've seen in the context of Europe and North America, though, are very intense series of individual outbreaks inside long-term care facilities, which have been quite devastating. And the risk of such events occurring into the future, as long as the virus is here, there's always an opportunity for that to happen. But at the same time, it is very difficult to reduce that risk to zero. So I think each country is going to have to look at how can we minimize the risk of bringing disease into such a setting. And there are lots of measures that can be done to minimize that risk. And even more importantly, how are we going to pick up a signal that something has gone wrong, that there may be a case in that situation, and how do we rapidly shut that down? and deal with that very effectively. And that's going to be that. So both the risk reduction and the risk response, the response to an event if it occurs. I'm sure there are many, many, many older people living in long-term care facilities who, at the best of times, are lonely, and for the last number of weeks has been a terrible ordeal for them, both to be further isolated, but also with the constant threat of potentially becoming sick with this disease. As the disease dies down or comes under control at community level, then the risks obviously reduce for those long-term care facilities. But the consequence of disease getting into those facilities, I think, is clear and stark. So how do we protect and shield our oldest and wisest and most precious members of our society, while at the same time not entirely cutting them off from the very things that makes us human, and that's our ability to be part of a community. And these are trade-offs that are very difficult to manage. My own view is that the risks can be managed. They need to be recognised, then managed. And if in a situation where we do see disease occur in a long-term care facility, we must be ready to react very quickly to stamp out that disease. It's also important that carers in these facilities have adequate training, that there's an adequate design in facilities, there's adequate staffing in facilities, and that we look again at the support, design and environment that we offer for our older citizens, and that those environments are made not only more comfortable and more human, but also safer. And I believe that can be achieved, and I believe there are lots of ideas on how that can be done. So I think we need to maybe also look at the model of the way in which we're providing care and support for our older citizens. So there's a lot to be done, but I do think it's a major issue. I think if you look around Europe now and in North America and Canada, a large proportion of the intense disease transmission is actually concentrated in long-term care